Hello everyone, my name is Pluma Rangel, and today I'm going to be doing my nutritional PSA project on the topic of eating disorders. So let's get started. So what exactly is an eating disorder? Well, an eating disorder is behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotions, and they can be very serious conditions affecting physical, psychological, and your social functioning. So these are just some of the types of eating disorders that I'm going to be discussing in my video today. The ones in red are ones that are not really talked about, but I wanted to make sure that I did speak about in my own video. So we're going to be discussing anorexia nervosa, bulimia nervosa, binge eating disorder, other specified feeding and eating disorder, avoidant food intake disorder, and lastly, pica. So let's get started with anorexia nervosa. So anorexia nervosa is characterized by self-starvation and weight loss resulting in low weight for your height and your age. And there are actually two subtypes of anorexia nervosa. The first one is going to be the restricting type, in which individuals lose weight primarily by dieting, fasting, or excessively exercising. And the second one is the binge eating or purging type, in which a person is going to engage in intermittent binge eating and or purging behaviors. Some signs and symptoms of anorexia nervosa is going to include a fear of weight gain, very low weight, and being obsessed with your body image. So next we're going to discuss bulimia nervosa. And so individuals with bulimia nervosa typically alternate dieting or eating only low-calorie safe foods with binge eating on forbidden high-calorie foods. So signs and symptoms of this are going to include excessive exercise, vomiting, and fear or guilt during an eating episode. So now we're going to be discussing binge eating disorder. So people with binge eating disorder have episodes of binge eating in which they consume large quantities of food in a brief period, in which they often experience a sense of total loss of control over their eating and are distressed by the binge behavior. Some signs and symptoms for this is going to include shame or guilt, eating when you're not really hungry, and feeling a loss of control while you're having one of these episodes. Next is other specified feeding and eating disorder. This one gets a little tricky, so I'll do my best to try to explain it for you. So this diagnostic category includes eating disorders or disturbances of eating behavior that causes distress and impair your family, social, or work function, but do not fit the other categories listed on here. So it is very general, but still is able to affect your daily life. So this disorder includes subgroups such as atypical anorexia nervosa, subthreshold bulimia nervosa, and subthreshold binge eating disorder. Next is ARFID, or also known as avoidant restrictive food intake disorder, and somebody who has this is going to have a persistent failure to meet nutritional needs and have often extremely picky eating. It is mostly seen in younger children, but again, not exclusive to them. And some signs and symptoms is going to be a lack of interest in foods, a fear of choking when you're done eating, and limiting to just how much food that you are eating. And then lastly, I'm going to be discussing pica, is which when a person repeatedly eats things that are not food and don't have any nutritional value. Some signs and symptoms are going to include stomach pain and discomfort, bowel problems, and having behavioral changes such as being aggressive. And this may include things such as eating rocks, baby powder, and dirt, as we can see from our visuals. So what causes an eating disorder? Well, this one's tricky as well. So eating disorders likely emerge from a complex relationship between genetics, personality traits, and environmental influences such as childhood experiences, social comparison, stressful or traumatic events, or cultural beauty standards. And although the roots of disordered eating will likely remain for a very long time, so until then, we can just only assume or guess. But it's very personal, so it changes from person to person. So now I'm going to provide some statistics and facts that are totally going to shock you. The first one is 9% of the U.S. population, or 28.8 million Americans, will have an eating disorder in their lifetime. Next, every 52 minutes, one person dies as a direct consequence of an eating disorder. And lastly, over 3.3 million healthy life years worldwide are lost yearly because of eating disorders. I think these numbers are just way too high, and the only way that we're going to see a lower rate is for people to get help. So now I'm going to discuss some treatments and such if you or somebody you know is dealing with an eating disorder and would like to get support and help. So here are some hotlines that I have provided. The first one is to text NEDA to 741-741 for 24/7 crisis support. NEDA is the National Eating Disorders Association. Next, you're going to want to call the Anorexia Nervosa and Associated Disorders hotline at 1-888-375-7767 between 8 a.m. and 8 p.m. Lastly, you're going to call the Within Eating Disorders organization at 866-458-46 4407 for a free consultation. Keep in mind, all these hotlines are completely free and they are 100% anonymous as well, so they're very private. And that sums up my PSA. Thank you so much for watching this video. I hope you're able to get educated and now you can educate others. And thank you so much. I enjoyed this class very much. See you next time.